Flat feet is a very common diagnosis that I see every day. It can be a whole breadth of patients, from young patients to elderly patients. Do patients need surgery is a tough question. Number one, it all depends on what is the underlying cause of the flat feet. Number one, are they born with it? Patients who are born with flat feet do not necessarily need surgery unless they're having pain. Is it acquired? You can have a traumatic injury to the foot that could lead to a flat footing, or you can have a degenerative process where one of the tendons ruptures or becomes insufficient that leads to the flat foot. And if it's painful, then you may require surgery. There are two options for flat foot surgery. One is a flexible reconstruction, where a tendon is transferred in the foot along with shifting the heel bone to change the anatomy. The other option is a fusion surgery, what is called a triple arthrodesis, where multiple bones in the hindfoot are fused to correct the malalignment. If you do have flat feet, please call our office so we can evaluate you, obtain x-rays, and determine your true cause of the flat foot, and determine if surgery is necessary for you.